you for watching Mulago News channel. So it comes from you breathing in the TB bacteria produced from someone, yeah? So that's how you can get it. Now, how can we prevent it?
Men are still a problem and they have more problems. When we are doing intervention, we get targeted. That's why you see one of the strategies, we go to the community. We have a routine. We have brought portable X-ray and mobile trucks for the entire country. Even yesterday we received 11 or 9 trucks.
More men die of tuberculosis due to poor health-seeking behavior. Meanwhile, drinking, mining and other social tasks put men at high risk of contracting TB. This is Lao News Channel. I am Denish, Ongora. I bring you the details of what the professionals of Makerere University College of Health Sciences and Lung Institute shared with the journalists at the Journalists Engagement Meeting on TB held on the 27th of August at the college conference room. Dr. Winston Mutamba of Makerere University Lung Institute and the project manager Light Consortium that targets campaign against tuberculosis said the 2 over 3 of the persons with TB in Uganda are men because of their indulgence into risky practices like smoking, alcoholism, mining, among others. And yet he said they have poor health-seeking behavior that make them to always realize late that they have TB. The behavioral change communication specialist at the Ministry of Health and the research uptake manager of Light Consortium, Kato Suleiman, said TB kills men 4 times as opposed to women because of the social factors that discourage them from seeking health services. Suleiman said the qualitative research carried out in Nakasongola district shows that cattle keepers and students are more knowledgeable on TB compared to border men, prison officers, and fishermen of Zengebe landing site. Kato said they have come up with an intervention targeting men under community awareness screening and testing CAS Plus project. Dr. Jasper Nidoi, research scientist of the Light Consortium, said men suffer from TB more due to the absence of any policy targeting men to address TB issues and unprofitability of TB to private health facilities. Dr. Nidoi said a person living with TB can infect 5 to 15 people in a year. This put members of the families of the persons with TB at a high risk because the disease is airborne, though is preventable through wearing masks and avoiding crowded spaces. According to Dr. Nidoi, a new strategy has been tested in hospitals of Kiboga, Mityana and Gombe and was able to mobilize a lot of men and women who are screened and tested. The strategy will be enrolled to facilities in other regions. Over 90,000 people in Uganda contract TB annually, and yet the survivors continue to suffer from physical challenges, hence unable to work due to scars in their lungs, causing economic challenges at their households. This is according to research scientist Dr. Beate Ringwald, who is also a lecturer at Makerere University Lung Institute and Liverpool School of Tropical Medicine. It has brought us to the end but this channel has more videos for you. Check them out and bye.
Thank you for watching Lango News channel. Please subscribe for more updates.